you, and hi, this is Elisa Ghirardelli. I am a principal research scientist with NORC at the University of Chicago, and I'm here to talk about some research that we conducted with IFENS, looking at the quality of carbohydrates, beliefs, and behaviors among consumers to better understand what they know, what they don't know, as well as what might work for them in the future for communication strategies. So we know that consumers are exposed to many different sources of information on food and nutrition, and specifically carbohydrates. And this is very challenging for consumers to know what kinds of things they should be eating or where they need to go for information. So these create challenges among consumers. Nutrition facts label includes carbohydrates, and the FDA does have information about how to read the nutrition facts label and how much is needed each day. However, from our research, we found that from our respondents in our phase 1, that information about carbohydrates that they're getting is mostly from social media or through internet sources. And we found that many of them are not trusting government sources about carbohydrates and other kinds of nutrition information. The other thing is that the USDA Dietary Guidelines Food and Nutrition Information Center has little information on carbohydrates. So other than the statement below about the National Academy of Sciences and Engineering and Medicine and the academies having the dietary reference intakes, as well as the information about different macronutrients, there's really no information about carbohydrates other than things in the footnotes of content areas or in a table. Also, when you go to the USDA Food and Nutrition Information Center, it sends you back to the dietary guidelines, the DRIs, and My Plate, which do not have much information at all about carbohydrates. USDA My Plate doesn't include carbohydrates or any explanation of which foods include carbohydrates. And other sources have information on carbohydrates, but the focus is on sugars and grains and less on fruits and vegetables. Project IFEN sought to consider the alignment between carbohydrate foods that experts are not aligned on in terms of their consumer ratings and healthfulness, but also to explore the consumer certainty on the assignment of foods to that category of carbohydrates, and to also think about messages on message platforms that would be related to the quality of carbohydrate foods with consumers, and to think about what their trade-offs are in decision-making among consumers when they're choosing carbohydrate foods, and for parents to help think about their children and making healthy choices and teaching them how to do that. So this research started with a phase 1 that was a very exploratory phase where we wanted to understand consumer terminology and views about the quality of foods with carbohydrates. And then we convened an expert group, and that moved us into the second phase, which was when we focused on understanding from consumers how they decide if a food contains carbohydrates and any of those trade-offs that they make when selecting foods. And then we also tested some initial ideas for message platforms, which were explored in the research. So to do this, following our IRB approval, we used market research data to target audiences via social media and advertising. So these were to bring in individuals that were known to purchase foods, healthy foods, supplements, and those that had interest in nutrition topics. So for screening into phase 1, we had about 1,300 responses, and then over 1,400 for phase 2. These were both convenient samples, and we screened for being over 18 or over. And then we also screened out for supplement or nutrition industry background. And then we also balanced demographically and geographically so that we ensured diversity across the groups. And we conducted these online with about 8 to 10 respondents for 4 groups in each phase. So in phase 1, we asked consumers to take the terms that they used to describe carbohydrates to consider where they would place them on one side or another of a whiteboard in terms of their quality. So we had lower quality foods and concepts that were on the left side of the board, and higher quality foods went to the right. And then we asked about what might land in the middle, or which foods that respondents struggled to place on either side of the board. So this is just an example of one of the boards that we included in our findings of the research. And you can see that there are things that usually are considered lower quality, sodas and chips and French fries and chocolate and other kinds of sweets ended up on the lower quality side. And there was some confusion about things like Slim Jims. And then also on the higher quality side, we had lentils or complex carbohydrates and beans, oats and barley, fruits. Bananas and oranges were specifically named, as well as whole grains, fibers, and then we did have veggies over there on the right side. But there were a lot of foods that landed in the middle, such as rice, bread, potatoes, cereal, pasta, and milk. So when we asked respondents to consider what didn't fit into the lower or the higher quality assignments of the foods, we really focused on some of these foods that we wanted to understand better. So in the following slides, you'll see when it was higher quality versus lower quality, all of these foods were included in higher and lower. So you can see that we had potato and bread and pasta and rice and air pop popcorn that were in higher quality, that were considered foods to eat, that were carbohydrate foods. And then in lower quality, we also saw potato, dairy and milk, cereal, bread and pasta, rice and popcorn. So these kinds of gave us some indicators of which foods we might want to test and better understand why they're sort of in the middle, or also seen as lower or higher quality foods, and to dig into those a little bit more in the phase 2 research. So also in the phase 2 research, we wanted to understand how consumers decide if a food has carbohydrates. And so we asked them to write down what makes a food rich in carbohydrates and then to reveal it to the camera. So this would give us top of mind responses. And you can see that sugars and starches and the amount of sugar and the amount of carbohydrate, if it's a grain or a whole grain, and if it's on the nutrition facts label or on the ingredients list, that will give you, those are the sort of top of mind responses that we heard from respondents. We also then conducted a poll during our sessions, and in that live poll, we gave them responses to actually be able to select. So we included an introduction that says, I know which foods have carbohydrates. If they are starches, have added sugars or sweetened with sugars, or their grains or cereals, or it says so on the nutrition facts label. But fiber and fruits and vegetables and beans and legumes kind of landed on the bottom of the list for where people were thinking about deciding if a food has carbohydrates. So for the next few slides, you can see some of the responses that we heard from the attendees to the focus groups. We heard that all nutrition things are tricky to put into words, and carbs are on the nutrition facts label, but they really didn't understand what they were. And that fruits and vegetables have carbs, but most of the time they don't have any labels, so we really don't understand. Carbs are not just grains, they're other foods. In the pyramid, which is an older version of my plate, that needed to be taken into account so that saying a statement encapsulates what a carb is challenging. We also heard that it's hard because there are differing levels of carbohydrates due to a glycemic index and the ratio of fibers. So it depends on quality, which depends on processed versus unprocessed foods. We've also been heavily marketed to think that carbs are bad. So it's to think of it in another way is it's easy to be deceived. Unique eating styles, habits, needs. So saying any statements about carbs are hard because it won't pertain to everyone. So we heard a lot of different things about deciding if foods have carbohydrates and why it's challenging to do that and to understand when to choose carbohydrate foods. So we also explored in the phase 2 research trade-offs and making choices about foods with carbohydrates. And so we learned that consumers are making many trade-offs, and they're challenged by a lot of different choices in their decision-making process. They do want to balance their nutrition, but they struggle with many decisions related to processing, taste, satiety, and the kinds of activities that they're involved in. We also wanted to test some ideas for message framing or platforms, but we weren't able to reach a consensus on a unifying message. We did find out that consumers are concerned with added sugars more than fats or sodium, and this would align with what we see in the media and in the information that's available online. They responded positively to messaging about identifying foods with carbohydrates to eat more of if they have fiber, if they're fruits or vegetables, beans or legumes, or whole grains. But these were not on the top of the list when we asked them, how do you decide if a food is a carbohydrate? They also reacted positively to the idea of having healthy carbohydrates being plain foods without other added ingredients. So then we also conducted a live poll to capture their thoughts collectively using some response options and asked about their trade-offs when making these decisions. And so then actually it flipped where it said, I eat foods with carbohydrates based on if they're fruits, vegetables, beans, legumes, or whole grains, how processed they are, if they have healthy nutrients, and if they affect my health outcomes. So after talking about a lot of these ideas, the fruits and vegetables, beans, legumes ended up at the top of what they were thinking about in terms of their trade-offs. So the findings from the qualitative methods in phase 2 and in phase 1 indicated that there's some consumer confusion about carbohydrate-rich foods, as well as their healthfulness. Consumers were selected because of their tendency to have interest in making healthy food choices. And so we didn't include individuals that didn't really have interest in being active consumers. So because we knew then they would struggle with the conversations that we were having. So these were consumers that were more likely to take interest in making healthy decisions. But we did learn that they make choices based on reading the food label and generally care about their health and nutrition. And they're also exposed to a variety of messages and information about food. The greatest amount of confusion that we learned in phase 1, as well as in phase 2, and some of the deeper dives that we conducted, were that pasta, breads, potatoes, alternative milks, all are challenging for understanding where those fit on the scale of healthfulness, if they're healthy versus unhealthy. And we heard a lot of that depends on what you add to it and how it's been processed. We also heard that consistently people thought that oatmeal was healthy, but they also thought that sports drinks were healthy too. We also wanted to understand more on their thoughts on how they decide if a food includes carbohydrates. And there appears to be some confusion as to how they make that assessment. They do seek guidance about carbohydrates in general, but we did learn from phase one that that's mostly through social media. Most admit to confusion, and very few are clear in their assessment. Most of the time, they don't view fruits and vegetables as foods with carbohydrates. They do decide if foods or have carbohydrates mainly based on how much sugar they have or if they're starches. So we feel like there are some next steps that we could take here, and we could capture more details about the trusted sources of information and the media channels that are being most used for health information and the pathways that are followed to actual accurate information. Also, understanding insights from consumers on other factors that contribute to their knowledge about carbohydrates could be important. So, understanding what we're seeing in other consumer surveys, as well as reviewing data about the time span related to the expansion on any access to information. So with the nutrition facts labels and changes to the nutrition facts labels, it's interesting to understand sort of, well, how does that have an effect on consumers' choices and information seeking behavior and decision-making behavior. Also to identify the potential for sources of misinformation and where consumers are hearing this more confusing information about carbohydrates. Also to think about the potential to conduct some social media listening to understand what's actually out there in social media and what's happening to communicate about food-related decision-making behaviors, specifically for carbohydrates. Some other next steps that we're thinking about are developing consumer messages. These were not actually developed as part of the phase two research. We did do some initial message framing, which we feel like needs to be refined, and there needs to be more input from experts to determine priorities and challenges. We also feel like we can't look to consumers themselves to create messages. We can only test message frames, and so final messages that include a rationale and clear call to action for decision making will be important to develop to help consumers make better choices. We can use our learnings from phase one and phase two of our research and also explore expert and consumer misalignment on those specific foods that have the greatest need for message development and clarification. The pasta, the potatoes, and the other foods that landed in the middle, like alternative milks. So with that, we look forward to working with IFENS more in the future to develop additional insights and better understanding on consumer understanding of nutrition related to carbohydrate foods and their quality. So thank you.